Knock knock, hello. I'm Elizabeth. I'm going to be your nursing student today, and I'm here to get your vitals and also do a pain assessment on you.
Okay.
Could I have your first and last name, please?
C. Green.
And your date of birth?
4/15/98.
Okay. Do you have any allergies?
No.
Okay. So then I'm just going to put on some hand sanitizer just to perform a hand hygiene. And I'd also put on gloves, and I'm just rubbing until my hands are dry. Okay. So now I'm just going to move on and do the temperature, do a temporal thermometer. So I'm going to start at the middle of the forehead and then move towards the hairline. Right, 96.7. This is colder than we want, so I'm just going to try it one more time just to see if I got a little bit of a warmer read. Okay. So 97.5, and that's about a good zone for temporal temperature. Then I'll move on to the blood pressure. I'm going to do a two-step blood pressure. So first I'm just going to get an idea for what the systolic blood pressure will be. So I'm just putting this up on the patient's arm. I'm making sure that the cuff is about 2.5 centimeters above the elbow, and I'm lining up the artery lines with the cuff on the patient's arm. All right, perfect. Then, great. Could I just have you hold these for me for a second? Thank you. And I'm just gonna grab a pillow just so the blood pressure cuff is a little bit higher, closer to the height of the patient's heart. All right. So then, could I also have you hold the gauge for me, please? Thank you. So now I'm gonna move on and get to the patient's pulse. And so I'm going to inflate the cuff until I can no longer feel the patient's radial pulse, and then I'll know that that's around where their systolic blood pressure will be. So I'm going to start inflating. For the patient's pulse, all right. Okay, I stopped feeling it around 120. So I'm gonna go 20 above that, or 30, but I'm gonna go just until 150, just so I am good within that range. Just gonna do that again, hand hygiene. Make sure my gloves are good, okay? And then I'm going to move on to getting the patient's pulse and their respiration. So I'm gonna count for 30, I'm just gonna count their pulses for 30 seconds. Okay, so I got 45 beats, so I'm going to multiply that by 2, so that equals 90 beats per minute. All right, so then normally I wouldn't tell the patient, and I could just keep my fingers here on their pulse, and then I'd count their respiration. So I'm going to do that for 30 seconds as well. Okay, I got 8 within the minute, so I'm going to multiply that by 2, and that's going to be 16. Once again, just doing hand hygiene. Okay, and then I'm going to move back to the blood pressure. Now I can get my stethoscope out, and because it I didn't feel the beat anymore around 120. Just gonna go up 30, and I'm gonna start at 150, the blood pressure, just to make sure that I get the systolic blood pressure. Okay. Just cleaning off my stethoscope. Okay. Perfect. Could I have you hold the gauge for me, please? And the arm is already on the pillow, so that's good. And we've given the arm about a minute to rest, so the blood pressure will be more accurate. Okay, so just gonna inflate up to 150. And then just going down to about every second. Okay, so the first time I heard noises was at 118, and then the last time I heard noises was at 176. So her blood pressure would be 118 over 76. Thank you. Just I can take this off. Perfect. And I can also remove that pillow for you. And then I can also just get your pulse ox as well, just to see how much oxygen is in the patient's body, in their blood. And I'm just putting the pulse oximeter on the patient's finger, and I'm just waiting for the result. 97, that's within normal limits. Okay, now I'm gonna move on to the pain assessment. Are you experiencing any pain today?
Yes.
Okay. From a scale of 0 to 10, 0 being no pain and 10 being the worst pain you've ever felt, where do you lie?
About a 6.
Okay. Where is the pain located?
Oh, I tripped and fell last night, and I hurt my knee.
Okay, got it. Is the pain constant or is it intermittent?
It's constant, kind of throbbing.
Okay. When did the pain start?
Last night, after I fell.
You fell. Okay, got it. Are there any additional symptoms that you're feeling, like nausea, vomiting, a headache?
My tummy has hurt today, and I've been a little bit nauseous, but it could be because I have my period.
Okay, so you're menstruating.
Yes.
Got it. Okay. Well, tell me if that increases at all.
Okay.
Is there anything that helps with the pain in your leg?
I've been taking Tylenol last night after it, and then I took some this morning, and that has helped, and then I've been putting ice on it.
Okay. Does the pain move anywhere else?
No, just my
Okay.
knee.
Okay. And then do you so you said that you tripped, so that's when the pain originated.
Yeah.
Have you ever felt anything like that before?
No, not that I can remember.
Okay, so this is the first time you've ever felt something like that.
Yeah.
Okay, so I am gonna update your chart just to get all that information down, and I'll check to make sure that you don't have any orders that maybe could help bring down the pain.
Okay.
So, thank you. And I'm just gonna do hand hygiene one more time. Is there anything else I can do for you?
No.
Okay, I put the call light near the patient and show them that it's normally a red button, but depending on the facility. And make sure that their bed's down all the way and that their area is safe. Okay,
Thank you.
welcome.